As we mentioned in our intro video, the physiology of pregnancy is incredibly unique. It's everything you learned about physiology, but times two. And what's more, these physiologies are connected. In this sketch, we're going to cover the most important physiologic changes that occur in a woman system by system. In our next sketch, we'll go over the other half of this equation, the fetus. Looks like class is back in session, but this time it's an outdoor gardening class? Man, schools have gotten fancy these days. Well, we better see what's happening over at the kindergarten. So first, let's talk about progesterone, symbolized by this protective dome. This is the main hormone that's the cause of so many of the physiologic changes seen during pregnancy, which is why we've placed the dome over this uterus plant. The upstream effect of progesterone is that it causes smooth muscle relaxation, which is the catalyst for a lot of the physiologic changes in pregnancy. We're going to till up the details of the effects of pregnancy on each system, so grab your gardening gloves and let's go. This girl over here looks like her heart is aflutter, so let's start with the cardiovascular system. As we just mentioned, elevated progesterone causes smooth muscle relaxation, which in the cardiovascular system means vasodilation. This must be why this girl's sleeves and pants look mighty dilated. The overall effect of this is decreased systemic vascular resistance, symbolized by her untied shoelace, a recurring symbol for decreased SVR, and lower blood pressures. In general, pregnant women have decreased blood pressure from their baseline for up to 24 weeks, and then the blood pressure tends to rise again. Of note, a woman's blood pressure should at no point be higher than prior to pregnancy, but that's a whole nother can of worms, which we'll cover in our sketch about hypertensive diseases of pregnancy. Pregnancy also causes an increase in the baseline heart rate. A normal heart rate in pregnancy is between 90 and 100 beats per minute. Due to this increase in heart rate, the decrease in systemic vascular resistance, and increase in blood volume, which we'll cover more in a little bit, the overall cardiac output is increased in pregnancy, which we'll remind you of with this heart spigot pouring out a ton of water. Due to this increased cardiac output, you may hear a systolic ejection murmur in these pregnant patients. Moving on to our next system, the pulmonary system. Within the pulmonary system, progesterone affects central respiratory centers and makes them more sensitive to CO2. Just like how this plant is one of those special ones that is extra sensitive to its environment. While the downstream effect of this is extensive and not completely elucidated, it is in part responsible for the increase in tidal volume found in pregnancy. So we've turned up the volume on this radio way high. Man, this plant is sensitive. It needs some jams to grow. Tidal volume is the volume of air that's moved in one breath. Just like this tune seems to be blowing the air out of these speakers. Because the respiratory rate itself stays the same, the increase in tidal volume causes an increase in minute ventilation, which is the total volume of gas inhaled and exhaled in a minute. So that's why the radio is only set to play for 60 seconds. Since a pregnant woman is exhaling a higher volume of air per minute than a non-pregnant woman, she's blowing off more CO2, just like this boy blowing into the wand. This increase in minute ventilation puts her, as well as all other pregnant women, in a state of chronic respiratory alkalosis, which is why we've made this wand in the shape of an OH. You can think of all these changes as being beneficial to the fetus. Because there's a lower amount of maternal CO2, there's a CO2 gradient that favors the fetus unloading its CO2 into the maternal circulation to get rid of it. In addition to chemical and physiological changes in the pulmonary system, there are also mechanical changes during pregnancy. As the uterus expands with the growing fetus, the diaphragm becomes more and more elevated until there's a decrease in the total lung volume during the third trimester, which we've symbolized as this raised but small third plant. Now let's move on to blood. Pregnant women have a lot of blood in their bodies. Just like there are a lot of red balloons over in this part of the garden. When we say a lot, we mean a lot, up to a 40% increase in total blood volume. If you think about it, this makes sense because they need all of that extra blood to perfuse the uterus and placenta as well as to deliver nutrients and exchange waste with the growing fetus. Keep this in mind when you're in your first C-section and see, well, a lot of blood. You're not hallucinating. It's a lot more than you'll probably see in any other surgery. This increase in total blood volume is due to both an increase in the number of RBCs as well as an increase in total plasma volume. Increased levels of maternal erythropoietin causes an increase in the number of RBCs in the maternal circulation. This is what makes it possible to deliver more iron to the developing fetus. However, there's a proportionately higher increase in the plasma volume, up to 50%. So overall, there's a dilutional anemia in pregnant women. On labs, this is reflected in both a lower hemoglobin and hematocrit. The cutoff for a normal hemoglobin in pregnancy is 11 grams per deciliter. Anything lower than this, and you will want to be concerned for other causes of anemia. We've symbolized this important fact with these deflated red H11 balloons in the water over here to remind you of the definition of anemia in pregnancy and that the lower threshold is reflective of the overall dilutional anemia. While we're over here by these blood red balloons, it's very important to discuss that pregnancy is a prothrombotic state. We've used our recurring symbol of bunch sticks to remind you of this increased propensity for clotting that lasts up to 8 weeks after delivery. This prothrombotic state is due to both a decrease in protein S activity, symbolized by this kid burying Sergeant S into the ground, as well as an increase in fibrinogen and some coagulation factors. This is important to note because of the higher risk for DVTs and PEs amongst pregnant women, and is the reason you may see use of DVT prophylaxis while on LND. Ooh, what's blooming over there? Let's head over to this bed of kidney plants to see what's going on with the renal system. Progesterone affects the renal system by causing relaxation of the ureters. They're smooth muscle, to be exact. So we've given this watering can a dilated spout. This, in addition to increasing compression of the ureters by the expanding uterus, represented by this compressed and dilated hose, causes a physiologic hydronephrosis during pregnancy. That increased blood volume we just talked about also affects the renal system. Since the total blood volume is increased, there's an increased blood flow to the kidneys. This causes an increase in the glomerular filtration rate, which in turn manifests as a lower BUN and creatinine on labs. We've symbolized these changes with this filtered sprinkler spraying a ton of water over the kidney plants. Over here in the compost pile, we've buried a hamburger bun and credit card to remind you that BUN and creatinine are low in pregnancy. An increase in GFR is also the reason you may hear so many pregnant women comment on how much they have to pee. Finally, the increase in GFR also causes an increase in glucose excretion in the urine. It can be normal to see trace glucose on urinary studies in pregnant women. Why is this sugar water in the bird feeder yellow? Moving on to this intestine-looking tree and the GI system. Some of the best-known side effects of pregnancy are nausea and vomiting, which occurs in greater than 50% of pregnancies. Although the exact mechanism hasn't been elucidated, it's been theorized that an elevation in various hormones, such as HCG, progesterone, and estrogen, can all cause an increase in nausea and vomiting. Acid reflux is another common symptom of pregnancy. There are many reasons for this. The first is due to the culprit for everything, progesterone. Progesterone relaxes the gastroesophageal sphincter, which allows more gastric contents to reflux into the esophagus. The stomach itself is also increasingly displaced upwards, which can also contribute to reflux. Poor kid, he's looking pretty nauseous. Did he just take a drink from that acid sprinkler? Not a good idea, dude. Not a good idea. In the musculoskeletal system, progesterone causes increased relaxation of the joints and ligaments, represented by this rubbery, bendy gardening tool. While it may sound like more relaxation may be like a vacation for joints and ligaments, it actually causes more back pain, which is a common complaint amongst pregnant women, and this kid with pain lines coming off of his back. Let's talk about skin next. Pregnant women will note many skin changes during pregnancy, so it's good to be able to reassure them what's normal and what isn't. In general, there's an overall increase in pigmentation during pregnancy due to increased melanocyte-stimulating hormone. This most often manifests as melasma, which is hyperpigmentation of the face. This is sometimes referred to as the mask of pregnancy, which is often seen in the same facial distribution as this kid with Play-Doh on her face. Many women also develop a vertical line down the center of their stomach, dubbed the linea nigra. As we mentioned earlier, pregnancy is a hyperestrogenic state. Common skin manifestations of this, which you may remember from studying liver pathology, are spider angiomata and palmar erythema. Finally, the endocrine system is another system that's altered heavily by pregnancy. Pregnancy is a state of increased insulin resistance. This is to ensure adequate glucose supply for the fetus. Man, this kid on the inside mat just can't get into this class. There seems to be too much resistance on that door. Cool. While the complete mechanism of insulin resistance in pregnancy has not been elucidated, there is one hormone called human placental lactogen, or HPL, symbolized by this milk crate, that contributes to the blunted insulin response. HPL is produced by the placenta and also goes by the name human chorionic somatomammotropin. During pregnancy, increased estrogen causes an increase in thyroid binding globulin, or TBG, which are the letters conveniently found in the best garden, the lovely location where this class is taking place. This means that more thyroid hormone is bound by this increased amount of TBG. So if you get labs, you'll see an elevation in the total amount of thyroid hormone, but no elevation in free T4. Again, this is because the increase of thyroid hormone increases the bound version due to the increase in TBG. Another hormone of pregnancy, beta-HCG, has a subunit that's similar in shape to TSH, so it stimulates the TSH receptors, causing slightly higher levels of T4 production in the first trimester, after which beta-HCG levels drop. We'll remind you of beta-HCG's association with the thyroid hormones by having this teacher wear a yellow sunflower on her shirt, our recurring symbol for the corpus luteum, the thing that beta-HCG supports. Despite these changes in thyroid hormone, pregnancy is a euthyroid state. Therefore, any deviance in TSH or free T4 should be investigated as it may be due to a thyroid disorder. We did it! Another class down. I think we all learned something about gardening and maternal physiology, wouldn't you say? Let's take one more look at this plant paradise before we head on over to our next class. We learned that progesterone is the cause of many of the physiologic changes moms have during pregnancy, mainly because of its effect of smooth muscle relaxation. In the cardiovascular system, smooth muscle relaxation causes vasodilation and a decrease in systemic vascular resistance, which in turn causes an increase in heart rate and cardiac output. You may even hear a systolic ejection murmur. Over in the pulmonary system, we saw that this plant is extra sensitive to the atmosphere, just like how the central respiratory centers are more sensitive to CO2 due to progesterone. This causes an increase in tidal volume and minute ventilation, which in turn causes a state of chronic respiratory alkalosis. Hematologically, the two biggest effects of pregnancy are the massive increase in plasma volume, which causes the dilutional anemia, and the overall prothrombotic state. This increased blood volume affects the renal system because the amount of blood flowing through the kidneys is a lot more than normal, so GFR is increased, which means BUN and creatinine are decreased. It wouldn't be pregnancy without some good old nausea and vomiting. And why not? Let's throw some acid reflux into the mix. As if pregnancy weren't uncomfortable enough already. Progesterone also causes ligament relaxation, which means women can become more flexible during pregnancy, sometimes too flexible, which causes back pain. Dermatologically, hyperpigmentation is very common, often seen as melasma or the linea nigra. Finally, pregnancy is a state of insulin resistance, in large part due to human placental lactogen. Also, the increased levels of estrogen causes an increase in thyroid binding globulin, so the total amount of T3 and T4 will be elevated, but your free T3 and T4 levels should still be normal. Listen to those birds. Nothing like being out in a garden. Hopefully we've planted the seeds of maternal physiology in your mind. Now we just gotta watch them grow. Till next time.